We're live. Good morning, good
Good morning.
afternoon, good evening, depending on when you're watching this live. This is the voice and the face of Dr. Tolu Olabintan, CEO of Livingspring Family Medical Center here in the good city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe that the quality of life is just as important as the quantity of life. I'm really excited to be here today to discuss the topic of how physical therapy could help with aches, joint pains, and muscle pains. And so, if you're watching this live, do me a favor, hashtag live. If you're watching this on replay, hashtag replay. All right, now to our guest. I am honored and excited to have you here. None other than Mercy Efuwape. I'm going to have you introduce yourself, please. And the question is, who are you and what do you do?
All right. Good morning, everyone. My name is Mercy Efuwape, and many people know me as Uche. I'm a physical therapist, and I got my degree from physical therapy in San Diego, California. And I'm the owner and founder of Mercy's Touch Physical Therapy and Wellness.
That's right. That's right. I love the name, by the way.
Thank you.
Mercy, you're like very, very, very good, very good. Now, inquiring minds want to know why do you do what you do? Why?
Well, I really love just having the opportunity to help people move at their best level. And as I was trying to decide, what area of healthcare I wanted to get into, when I ran into physical therapy, it was just so much fun because working with even from kiddos who, need help to establish like a baseline of how to move, how to
Mhm.
get started in this life, and then all the way through the spectrum of working with sports athletes or geriatric patients that need help moving as they age. So there's just such a wide variety of ways that we can help, and I just enjoy it.
So you help people walk at all stages of life, essentially. You help people move,
Absolutely.
improve their mobility. I love what you do. I love what you do. And it's so interesting. We as physicians we tend to send a lot of patients for physical therapy. And sometimes the conversation goes like this. Um, well, what will physical therapy do for me? It sounds like, they're not sure why physical therapy should be an option for them. So what would you say to those people who are asking, like, how is physical therapy going to help me? What would you say to that?
Okay. Well, I think the best way that physical therapy helps is we have a long time allotted for our evaluation. So just being able to get a full, thorough assessment of what is really going on, we can help individuals get to the root cause so that they're not treating, just the symptoms, but
Okay.
actually treating the root cause of an injury or an issue that they're having.
Okay. So first of all, for those who are watching, when you're sent to physical therapy, the first thing they're going to do is do an assessment, initial assessment to find out, okay, where are the areas of weakness, I guess,
Yeah.
and what areas need to be focused on. Now, one of the biggest, I guess, deterrents or this reason why patients say, "Yeah, I don't know if physical therapy is for me," is the time commitment. Okay, so someone is asking, well, doc, yes, I like what you do. I like that it's non-surgical. I don't have to do surgery. I like that you improved my quality of life as far as movement, being able to move my joints, being able to move my muscles well. But how much time do I really have to? Can I skip some of the days, or how many do I really have to commit to the time required by the physical therapists?
Yes, I'll say absolutely. So one of the biggest components of working with a patient for physical therapy is also partnering with them in establishing a home exercise program. So coming into the clinic, whether that's one time a week, 2 or 3 times a week, or having a therapist come to you in your home, the carryover is really, really important to be fully committed to all of the session times, and then also doing exercises at home on your own. So the commitment level is very important, and it just, of course, it depends on what the diagnosis is, what we're treating. It could range from a day or 2 times a week or 3 times a week, even in a hospital setting, therapy is needed like 5 days a week. So it just really depends on, what is going on, what the diagnosis is. But definitely the commitment level is very important.
So we can't really say that everyone needs this amount of time. It's individualized to the patient. So first you do an
Absolutely.
analysis, and then you decide, okay, how many weeks would we need to see you, whether in the hospital or outside the hospital. Now, I wanted to share this story. Good morning, Doc. So we have some people watching live. Chi, hi, nice to see you. Gracie, nice to see you. Oluchi, nice to see you as well. Thanks for joining. So I will share this story real quick. It's amazing how much inactivity can affect your muscles and your joints. I remember when I was pregnant with my first child, I had to be bedbound for a couple of weeks. And so 2 weeks of being bedbound, I decided to just get up and try to walk, and I flopped. Like I literally just slid down the floor, and I was like, oh my goodness, my what? Just 2 weeks of being bed rest, I could not walk, and so I called and insisted that I needed physical therapy because the feeling of not being able to walk is just yeah, very strange. And so I had physical
Yep.
therapy sessions. I was so
Absolutely.
surprised, just 2 weeks. So I'm saying this also to help emphasize the fact that physical therapy is very important. Being able to move, obviously, we know is important, but over time, muscles can get weakened either by inactivity, injury, right, after surgery. And so physical therapy is very important. And I've seen patients transition when committed to it, do very well after the session. So if you're watching and you know someone who's supposed to do physical therapy, you've been told to do physical therapy, I would strongly encourage that you give it a try. It works. It does take commitment though. The physical therapist, you call Mercy's Touch, you say, you know what, I want to come, I have an assessment, and she says, well, you're going to need 3 to 4 sessions a week. Commit to it, and then you're going to have homework, right? You're
Absolutely.
going to have
Absolutely.
homework, and you're supposed to do your homework. Now, people are asking, okay, yes, I love this. I love the idea of this, but how soon would I start to see results?
Okay.
I want, I need to get back to doing what I used to do before. What would you say to that? How soon can I get back to work?
Absolutely. So as far as seeing progress, again, it's case by case, depending on how significant the injury was, or maybe how the disease process might be going. But the idea of every physical therapy session is that you see some amount of progress every session. And so whether you're looking at the rating of pain or how much function you have, just different, how much range of motion you have. Our goal is to make an impact with every session. So it just depends on how you look at progress. You may not be able to jump back into the sport that you love right away because tissues have to take time to heal. But you should see some level of progress with
Okay.
every session.
Now, of course, these are medical suggestions. Every assessment would be unique to the individual, and so in combination with your team, your physical therapist, doctor doing the referral, they were able to find a personalized plan that works for you. Now, you
Absolutely.
mentioned something here. A lot of times people see physical therapy as something that you do to help with. Okay, you had surgery, it helps you get back, but you mentioned pain. You mentioned functionality, and then also you talked about range of motion. Can you expound a little bit on that? Well, obviously, pain, we know that it helps reduce pain, but range of motion, can you expound a little bit so people understand what physical therapy can help with, not just being able to move?
Okay, absolutely. So when we talk about range of motion, it's very important. It basically just means that the muscle is able to stretch through the full range of the joint. So there's no limitation with how much you can bend or straighten a joint. And that affects how you move or how you can play your sport, how you walk, just every aspect of how you move and how your muscles are working is based on if you have the full range and a pain-free range. So those are the reasons why therapy is always looking for how is the joint moving through the full range or not? Is it limited?
Okay, so you help with pain, you help with function, being able to actually use the joint, and also range of motion. So sometimes the wrists, right, can be loose, stiff, but with physical therapy, maybe we can do this a little bit more and lift things and
Exactly.
raise the roof better. It wouldn't hurt as much. So range of motion is very, very important.
It's
And
important.
sometimes people actually don't know they need improved range of motion to you
Yeah, you
actually.
may not even know that you are limited, and it does impact the way that you're doing. Let's say baseball player, softball player. If you don't have the full range, you're really not playing to your full potential. Or if you had a fracture at some point, the bones healed a certain way, you're not using the muscles correctly, then it affects everything. So yeah, that's something that we can look at together and really help with the function.
This is very good. So for those of you who are watching, you may notice that some things you were able to do before you were not able to do, or your flexibility has changed, or you start to hurt. Sometimes that's how your body tells you your range of motion is being affected. See your primary care doctor and ask to see a physical therapist. And Measures Touch isn't that in Texas, so yeah, but we'll talk more about that later. Good point. Now I have a question from a patient. From a viewer, I'm sorry, from a viewer. It says, when you have a random wrist pain or discomfort without lifting anything heavy, what could have been responsible? I'm going to give you a few minutes to answer that. I will say though, it depends on the type of pain that's being experienced here. A lot of things. Carpal tunnel, where a nerve is pinched, could be arthritis. It could be a lot of things. But what would you say to that? For someone who's saying, hey, who comes in for a physical therapy session? I don't know, my wrist just hurts without me lifting anything heavy. What could cause it, and how can I improve that?
Okay. And yeah, you definitely touched on some of the things it can be. So you're looking at, it could be nerve related, like you mentioned, carpal tunnel. It could be most likely related, or an overuse injury, maybe looking at how the muscles have been used before, or tendon issue. There's so many things it can be, really. It really is something that you'd have to get assessed, and your doctor would definitely help you kind of narrow down as well what the cause of the issue is. But without lifting at all, having pain, it might be something that you've been doing in the past, maybe repetitively, that is affecting how the muscles feel, the ligaments are working, or even how the nerve is maybe overused or inflamed.
Okay. Awesome. I hope that was helpful, sir. And I have another question, actually a comment from a doctor who's saying, you're right. I insist on physical therapy for all of my chronic patients at least 2 times a year. Even if they have done it in the past, is very important for chronic pain. So physical therapy also helps with pain. We talked about that earlier. Thank you for that feedback. Now I have another question from a viewer who says, how can I improve my lower back pain? I typically notice it in the mornings or during long walks. Physical therapy, but go ahead. Sorry.
I'm sorry, I couldn't hear the question.
So it says, how can I improve lower back pain? I typically notice this in the mornings or during long walks. I was going to say physical therapy, but get him.
Okay. So the first thing would be that getting a physical therapist and doing a thorough evaluation, because so many people have low back pain, and it can come from so many different things. It can come from maybe a lack of mobility in your spine. It can come from, how the muscles are used. It can come from just your posture, and how you are moving throughout the day. So it really is important to get in and discuss your specific case, to see, what is the root cause of the issue. One of the things that we can often suggest is that, like you said, during long walks, so maybe stretching, looking at flexibility before and after your walks, and then just being consistent with the exercises, so that you're also working on strengthening your core muscles, which has a big impact on how your back feels.
All right. So essentially, very important to get an evaluation to see what's causing the issues. Posture might be an issue. Core strengthening may be needed. And then also, if you're having this, especially with long walks, make sure you're wearing comfortable shoes that support the arch of your feet. And if you can try to walk on even surfaces. Of course, if you're taking walks outside, that may be hard to do. Sorry about that. So really important to get an assessment to determine what the issues are. And of course, physical therapy is an option to help with that too. Now, I have another question. Very active group, by the way. Do I always need to get a doctor referral to see a physical therapist?
So every state is different. I think most states in the U.S. are now have some form of direct access, but
Okay.
here in Texas, the physical therapy does not require a doctor referral. They can go through an evaluation and treat a patient up to 10 consecutive days.
Okay.
And then let's say if the intervention was enough, then the patient can discharge with no doctor's order. If we do need more physical therapy, then we coordinate with your primary care doctor or any referring doctor. We can continue at that point.
Okay. So 10 consecutive days, not sessions. So it has to be for 10
Right.
days. Okay. Interesting. So no to that answer, but it's limited. But at least for the assessment, I think that this is good that it's not always doctor mandated. Okay. Not always mandated. And but I would suggest, especially if you want to have maximal access to physical therapists, that you do speak with your doctor to get that referral. Okay.
Absolutely.
Another question is, what's the best exercise to do daily, especially for seniors?
For seniors, definitely walking, because it really works every muscle group. So core muscles, we're working on your quads with walking, you're working your heart when you're walking. So that's what I always advise my patients who just want to, if you give me just one thing to do, what will it be? I would say walking. And then another one is for seniors, another one is like sit to stand, just stand up, sit down. That's something simple that you can do. If you do like 20, 30 reps at a time, it really helps to target each and every muscle group. So at the minimal, those are the two things I would recommend.
All right. Sit to stand. You're doing your cores. You're strengthening your cores when you do that. In fact, one of the tests we do when we see our seniors for a physical is to do a timed get up and go to see how convenient or how easy it is for them to get up, turn around, kind of come back and sit. So that exercise, the sit to stand, is very good for core strengthening. It also helps minimize the risk of falls long term. I also wanted to add dancing. I think that is a good exercise for seniors. So, it uses all essentially all muscle groups. But you did mention walking and the sit to stand. So essentially just sit, stand up, sit, stand up. Okay. All right. Awesome. So next question is this. We send a patient to you for evaluation. How should the patient prepare? Are there things that would help enhance the interaction or the evaluation from you? So what would you say to that?
Yeah.
Oh, did we lose you? Mercy, can you hear me? All right, looks like we're having a little bit of technical difficulty. Let me give her a few seconds. All right, let me see. There's a different. Here we go. All right, looks like she's rebooting. All right, so while she's waiting, we're waiting for her to rejoin. The question was, what can I, not what can I expect? How can I prepare ahead of the appointment for, with the physical therapist? Okay, let's get you back on. Let's take this one out. And there you go. Welcome back.
Can you see?
I can see you. I was seeing double. I can see you now. All right. Well, people are hanging on. Thank you guys for waiting. This is awesome. All right. So the question was, how can someone prepare for the appointment ahead of you? We send patients off for a referral. Are there things they can do so they can make the most of the appointment with you? What would you say in response to that?
Definitely. I think the number one thing is just being able to ready to share a thorough history, because we're going to have a lot of questions of, what is the issue? When did it start? when does it affect you at work or while you're sleeping? Different questions like that. So just being able to have a thorough history kind of in your mind about what's going on. A lot if you can share what your goals are, so that as we're creating a plan of care, we're on the same page. So we know, what kind of exercises, how to cater our plan to you specifically. So if that's first time meeting, that helps a lot.
All right, awesome. So being able to say what's hurting, how long, what you've tried also, and also how it affects your quality of life, how it affects your ability to do the things that are important to you. That's also very important to be able to share,
Absolutely.
to help your physical therapist help you. I tell people this when I send them off to see specialists. You really want to maximize the visit. So having that information ahead of time would help you make the most of that visit. All right. The next question I was going to ask you is this, and I get this a lot from my patients. I heard already, doc, and you want to send me to physical therapy where they're going to make me do more work. What would you say to that person who's wary about hurting more during a physical therapy session?
Okay. I would say that don't be afraid. Don't be afraid of physical therapy. I think PT gets a pretty, I guess, rap
Right.
for being pain and torture and terrorists, and all those things are what people say a
Like a
lot.
surgeon, a Dre sergeant, get up, move now. Type. It can make them rap.
Right.
But yeah, go ahead.
Sorry, I think my connection is still really shaky, but
I can still see you. We can see you.
okay. Yeah, so don't be afraid of pain. It's definitely not the goal of physical therapy to increase your pain or to have you start at 2 out of 10 and leave an 8 out of 10, and that's just what it is. It's not really the no pain, no gain mentality that you hear a lot. So if you're working with a good physical therapist,
Oh man, we lost her again. Hang in there. Hang in there, guys. Let me see. Let's give her a few seconds. Oh, there we go. Yeah, there we go.
sorry about that. I don't know. The connection's really poor.
You're good. Let's answer the question quickly. So yes, so the pain concern with patients.
Yes. So as far as pain, just feel confident walking in, knowing that the goal of therapy is not to increase your pain. We're working with you to listen to what your symptoms are, and that we've also received education to know like how to work with you, what timeline the tissues are healing, so that we're not causing more of an issue or more of a problem for you. We don't want you in bed for 2 days after therapy because you're hurting so bad. We're working together to make sure that we're making the progress that we need to. So try not to be afraid of the pain. There's a bad rap out there. It's not more pain, no pain, no gain. It's we really will work and listen to make the improvements.
Awesome. And remember, physical therapy helps with pain. We talked about that earlier. One of the things I tell my patients too, especially if you've been cleared to use certain pain medicines, anti-inflammatories, is to use it before the appointment, so you can make the most of those
Absolutely.
joints and muscles. So don't be afraid. Okay, go in for the assessment, communicate, and the goal is to help reduce the pain. Oh my goodness. All right, sorry about that. Next question. Best tips to avoid knee hip replacement surgery. And this person is saying, I want to remain active throughout my life. What are the best tips? What would you say?
Just like your goal is to stay active, just keep staying active. Keeping a good, I mean, I know we're talking about exercise, but diet is so important. Because it really does affect the way that your body moves and the way that your muscles move or even recover in case of an injury. But just staying active, keeping exercise as a priority for you will help you to be able to stay active throughout the duration of life. Did I hear you mention surgery?
No, to prevent surgery. So to prevent, to avoid.
Prevent, okay, to prevent surgery, yes. And it is the same. Just staying active Also making sure, like we talked about the range of motion, how your body is moving. Is it moving effectively? Are you sitting, with good posture? Are you working with good posture? Just all of those kind of maintenance things that if you're doing the wrong things daily, you may not feel it, but in the long run, it could lead to surgery down the line, back surgery, knee surgery, all those things. So just every day working to improve your posture, your exercise, healthy diet, all of that works together to prevent future surgery and make sure that you're active in the future.
Awesome. So anything that stays in motion, who stays in motion will remain in motion. Activity is very important. For those who play sports, you want to be careful. Good posture with playing sports. Like when we do sports physical, we ask certain questions. Make sure you protect yourself. Make sure you're careful about overuse. Make sure you listen to your body. We talked also about healthy weight. A healthy weight is important to minimize the risk because, of course, more weight on the knees, on the joints, increases the risk for surgery. So maintaining a healthy weight and a healthy diet, I cannot overemphasize this, is important for maintaining the cushioning between your joints. A diet rich in fruits and vegetables and healthy nuts are very important to minimize the risk as well. And of course, when there's an injury, getting an evaluation as well to prevent re-injury, which can increase the risk of surgery down the line. Okay. This has been a very interactive group. We have more questions coming. Next question is, can a senior patient with arthritis benefit from physical therapy? I know the answer to that question. I'll defer. Okay. So she's going off again. But yes, I have seen patients I've sent to physical therapy. I had over 80, maybe 88-year-old patient who wanted to continue line dancing. And with physical therapy, we're able to get her back to doing that as often as she wanted. And so physical therapy, very, very, very important, especially when you don't want to avoid surgery, right? And still do the things you love. I had a patient who, had to have her hips replaced. Initially, she was afraid of doing it because of course, surgery. She had to lose weight. She lost weight. She did the surgery. She did physical therapy. Now she was back to running. Okay, so physical therapy, yes. Can a senior patient? That's the question. Mercy, can a senior patient with arthritis benefit from physical therapy? There's one more question I wanted us to address because I see this a lot too with patients. Is that for people with desk job, with COVID, a lot of people were working from home, working remote. Said people with desk jobs that have developed knee and back pain, what daily exercises can they do to alleviate this pain, and would they need physical therapy? That's a very good question. What would you say to that?
Absolutely. So I would say, as far as daily, working on stretching, because we get in a bad habit, a lot of bad postures like rounded shoulder, arched back. So just open up, stretch would be one thing that's very important. And then also getting moving. So if you've been pretty sedentary, walking is a great place to start with exercise. And then would they need a physical therapy evaluation? I say definitely. I think it doesn't hurt at all to get evaluated to see, what's going on. If you're feeling any pain or discomfort or just not able to tolerate doing the things that you like to do for as long as you used to, then yes, absolutely get an evaluation, and we can help. We can help.
Awesome. Now, one of the things I want to add to that, I've been recommending patients to get ergonomic evaluations. What that means is, what is the best positioning for your body with the job you're doing? So the angle of your arms, right? The angles of your knees, like to the floor, the level of your eyes to the computer. All of that can minimize the risk of chronic pain, neck pain issues, lower back issues as well. And so an ergonomic evaluation is very important. And physical therapy can help you with, posturing or recommendations as far as how you should sit when you work. Stand-up desks, I've recommended, sit to stand desks, so you can stand sometimes, you could, sit sometimes, so you're not in the same position for a long time. All right, we'll take one more question, which is a very, very good one. Someone's asking, can you tell us a major transformation one of your clients has had?
The connection again.
So good. Mrs. George, that's a very good idea. Stand up desk, and sometimes you can actually ask your work to provide that for you with a doctor's note saying that this is important for my back. Of course, this is medical. These are medical suggestions. See your doctor for a full assessment. But the question is, could you tell us? People are asking, what is one person? Like, give a story of a client you have been able to transform, or who has had a major transformation working with you.
Okay. Yeah, so I can think of several. The one on my mind right now is I'm working right now with a patient that was in a pretty serious injury. She's about 46 or 7 years old, and she had a crush injury on a horseback riding. And it fractured her tibia, plateau, tore her meniscus, ACL, all of it. So it was a pretty serious injury. She was off of her feet, non-weight bearing for, I think it was 12 weeks total. Had the external fixator and all of the nine yards. But so it has been working. I've been working with her now for 5 months. But now she's been able to get out of the wheelchair. She's back to weight bearing. We're off crutches now even, and we're just progressing to where she's getting be able to return to her sport, which is horseback riding. So
Wow.
the transformation has been pretty intense because we started with pool therapy, aquatic therapy, to now where she's getting very close to getting back to her sport. So
Awesome. Awesome. So for those who heard that, it's possible to go back to the life or the quality of life you had before an injury or before an accident. Now, of course, she has put in a lot of work, this patient. I bet over months, probably over years as well. So it's important to also stay committed to the work. All right, we're running out of time. And by the way, sir, physical therapist could do an ergonomic evaluation, but also an in-house safety or human factors employee at work can also do that. So I would recommend asking your job for that. And then, oh, let me get her back on. All right. You're here. We're good.
so sorry.
You're good. You're here. So aquatic physical therapy. Okay, so physical therapy in the water. Can we talk a little bit about that? Who would you say is a good candidate for that? What does it involve? What if you're afraid of water, you don't like to swim, or you don't know how to swim? What would you say?
It's not even important to know how to swim, to be quite honest. Doing the aquatic therapy, just being
So,
in the
so,
water
so,
is
so
so healing.
real quick, mindset block. You don't need to know how to swim to do aquatic therapy. You don't have to. In fact, you just need to know how to just walk in the water, right? So you don't need to know how to swim to do aquatic therapy. I just wanted to emphasize that. Go ahead.
Absolutely. And because we work at different levels of the water, it can be 3 feet where you can stand no problems, with that. But you're with a therapist that was with you. There's no harm there. But it helps so much for so many different conditions, whether chronic pain, even cardio patients benefit from pool therapy and circulation. Um, After surgery, if you're non-weight bearing, able to get in the water and weight bear and work on different aspects of therapy before you're able to do it on land, it is really, really, really helpful. I can't stress how actually wonderful aquatic therapy is.
And for those of you who are wondering, why would you go in the water when you could do the land? When you're in the water helps carry your weight. So you're not left to your joints alone and your muscles to do all the weight bearing. The water kind of helps carry that weight. So there's less pressure in your joints. So that is why it's very, very, very good. Now, before I don't want to lose you again, where people are wondering if people are saying like, hey, I love this physical therapist, I want to have an evaluation with her, how can we find you? Where can we find you?
Okay. You can visit my website at mercystouchpt.com. And you can send an email through there. I have my email. I'll put my email address as well. You can follow me on Instagram. I'm on there, but definitely going to the website and you can send your contact information. We can definitely get in touch to schedule evaluation or even consultation.
All right, you can get in touch with Mercy's Touch. Touche. I like that. All right.
I like
All right. And I'll be sure to put all that information after this live so people can reach out to you and request for physical therapy services and get back to living the life quality and in quantity. All right. Thank you so much for coming, Mercy. It was
Thank
nice
you.
having you
Thank you so
on.
much.
Okay. All right. Thank you all for watching. Please share. It is good to share for those who know that this could be useful to someone who's contemplating physical therapy, who's just had an injury, or even for your coworkers who may be complaining of back or neck pain. Please share this with them. That being said, thank you again for watching. We're done. We'll see you at our next live. And if you or anyone you know is looking for an awesome, a thorough, a passionate family physician here in the Texas area, I am she. Have a good one. Thank you, Mercy.
Thank you.